everyone. Welcome Dr. Prasham Shah to Chennai. He is here to speak at the PRISM First Integrative Medical Conference, and we've had a wonderful session today morning. So I would like to start asking Dr. Shah his interest in integrative medical space and his experience, how he got here, being an orthopedic surgeon for more than
40 years.
40 years. So you look very young, Doctor.
Thank you.
Please go ahead.
As you said very correctly, that I'm being an orthopedic surgeon, how I'm into an integrated medicines, which is mainly done by the physicians. So the thing was like this, that I was luckily the first Indian orthopedic surgeon who did Ilizaro technique. This is an orthopedic technique for limb lengthening. And this technique, when I did it, it was in 1989. And similarly, I became the first orthopedic surgeon to use ozone in orthopedics.
Right.
And it was surprisingly that I started realizing that not only orthopedics, it can be used in almost all the different faculties of the medicine and any kind of a diseases that you can use ozone. And the most interesting thing was that in 2000, or rather 1999, it was one patient of mine from UAE, from Dubai.
Right.
She had a backache, and she came, and then she said while going that even the ozone injection didn't work for me.
Right.
So I said, "What, madam? What did you say? Ozone injection? What ozone?" At that time, I didn't know ABC of ozone. And then I started digging the matter, and I said, "This is looks very interesting." So I immediately went to Germany, and I learned specifically the ozone from the person who are doing since Germany. They are doing since 20, 30 years.
Yes.
So almost 1950, 1960, they have started doing
Yes.
it. But in India, there was nobody doing it. And as an orthopedic surgeon, I was the first one to get it, ozone, in India. So when I learned ozone and I started applying it, then I realized the ozone is working like a magic. And it was almost like every orthopedic conditions, I could manage it with ozone injection.
Fantastic.
So the ozone can be given in a various ways, like you can give intramuscular injection, you can give intra-articular injection in the joints. It can be given in the muscles directly. It can be given into a spinal disc also directly. So it has got a various modalities. It can be also given as vaginal and rectal insufflation.
Yes.
It can be made into ozonated oils, and that can be used for so many beautification. So now ozone has actually really widened its horizon. It's right from the skin to the bone.
You can use for breathing as well. We can.
Yes, for actually, of course, you cannot directly
Yes,
breathe ozone
through the oil.
because ozone is very, very deleterious for the upper respiratory tract. So when you take directly, it may create a lot of cough and a lot of irritation, and it can even damage. So that's why in a European countries, when there is a very high level of ozone occurring at the lower level, then they literally announce it.
Okay.
It's like going to be announced like that today is going to be very heavy rain.
All right. Okay.
So like this, if it is too heavy ozone, then the people don't get out.
Right. Okay.
Or they use the carbon mask or something to go out.
Okay.
So that it nullifies the effect of ozone.
So ozone applications, very wide applications across these things, and you started getting very good results with it. I think, and the spinal injection is actually FDA approved. I think that's one of the things which is FDA is approved.
Slowly, everything is getting approved. In a way, of course, in India, FDA approval has no much meaning. Of course, we have to have the approval from our bodies. And then where we have a license kind of to use ozone in a disc especially. So as you said very correctly, FDA started approving the spinal disc. And the best part of it, this disc injection is anywhere you need a surgery to remove the disc. This is just an injection of ozone into the disc, and the disc is like regress back in such a way it is like a surgical effect.
Yes.
So without surgery, you are producing the results of surgery, and that's why this ozone is very, very blessing kind of to the human being. And in fact, if I can just tell you that looking at different modalities where we can use ozone into a different conditions, right from skin dermatology to gynecology to even cardiology and to everything. I can tell you that this has become like a Sudarshan Chakra of Krishna.
Wow.
You know, the Sudarshan Chakra, which can kill anything which is negative and toxin, it just kills. So even ozone kills all kind of bacteria, viruses. So it can be used in a various conditions. So much so that any viral infection you can use ozone.
Yes.
Like herpes. You don't take any antiviral which is so harmful to the body. And you just take ozone, which is given intravenously. You give 2 injections, herpes will disappear.
You're right. You're talking about direct intravenous ozone?
Yes, direct. But it is not a direct ozone directly.
Right.
What you do is you just take your needle inside, and then your blood is coming out into a special bottle.
Okay.
And that 50 to 100 cc of blood is ozonized externally.
Okay.
So there is no direct gas going into the system.
Okay.
So there is no question of any side effect or any pulmonary embolism or anything which can go wrong. So it is done everything externally, and that ozonized blood goes back. This is called the autoimmunotherapy using ozone.
Okay.
And it is now very widely used for various conditions.
Right.
To be very honest, let me just give you this example of my own mother. She had the first heart attack.
Right.
And I admitted her under cardiologist, and I said to my cardiologist, you continue your treatment, I'll continue my treatment. They said, what are you going to do? So I said, look, you have the ECG showing the ST depression, which you get it in your heart attack. One of the segment in ECG goes down. So I said, if I reverse this and show you in 48 hours to go back to normal, what would you give me? And he was surprised. He said, it's not possible to have.
Yes.
So I said, okay, let's have a challenge. So he said, okay, you carry on with what you want to do. So I gave my mother every day 2 autoimmunotherapy using ozone into the blood.
Yeah.
And I gave morning, evening. After 48 hours, I said, repeat your ECG.
This is 50 cc each or 100 cc each?
You take between 50 to 80 cc.
Okay.
Normally.
Okay.
And you can take even 100 cc. Up to 100 cc is not a problem.
Okay.
So I did that, and 48 hours later, to his surprise, his ST depression had gone.
Right.
So what does it indicate? That anything that happens in the body, like heart attack, like stroke, if you timely approach this with the ozone, then what happens is it does not allow the heart muscles to die.
Right.
See, heart attack is where the blood supply is not going to the heart. So that much portion of the muscle is getting dead.
Yes.
So 48 to 72 hours, if the muscle doesn't get enough oxygen or supply, then this muscle is going to be dead.
Yes.
And that you will get a permanent ST depression. You will find your overall output, your cardiac output will be less than 60 or 50. So these things gets reversed immediately. Why? Because when you give ozone in the blood, it immediately sends oxygen to the dead tissue.
And all the inflammatory markers just calm down.
Comes down. It is a fantastic anti-inflammatory. It's fantastic analgesic. It's fantastic anti-infective. And it's an immunomodulator.
Yes.
So even the immunological disease like rheumatoid arthritis, all these kind of diseases also can be conquered with ozone injections.
So in addition to, so you mentioned rheumatoid arthritis. In addition to ozone, is there any other adjuvants you would normally use in a patient like a RA patient?
Yes, of course. I would like to give, now we have a different technique to handle the rheumatoid. We don't give a standardized treatment, but we have something we call it a Mukherjee's regime. He is my colleague only, and he has developed this new kind of regime where we have 7 to 8 or 10 medications which are given alternate day.
Right.
So 100% no side effects of this medicine. And you give that and give ozone.
Right.
And the rheumatoid patients, they do very well.
And you are actually talking about the Mukherjee regime where the medicines are given at a lower dose.
Much lower dose.
Much lower dose where they don't actually experience any side effects.
Any side effects.
Along with the ozone
That's
major
right.
autohemotherapy.
That's very good.
And that's
very good. Because this is all like a disease modifying drugs.
Right.
So what normally they use it now, supposing as let's say a methotrexate.
Right.
So they will use in terms of about 10 to 15 milligrams a week.
That's right.
So this is just 2.5 milligram alternate day.
Right. Fantastic.
So there are no side effects, and the patients, they start feeling much better because it actually removes the inflammation from the root cause.
Mm-hmm. So you're seeing excellent results with this for RA. And are there any other conditions we can use the Mukherjee regime for?
Yes, for the avascular necrosis of the hip joint,
Right.
it is another wonderful method
Okay.
to use this. Any kind of a chronic inflammatory conditions,
Right.
you can use Mukherjee's regime.
Fantastic. Including some certain autoimmune diseases and things like that.
Truly, yes.
Yeah. Good. So, doctor, you're also part of IAOS,
Correct.
which is now
In fact, I was one of the founder member of IOS with
IAOS.
Dr. L. Prakash.
Yes, and they've got very active membership, and you do a lot of things. Your learnings over these last 30, 40 years, now, how is it being taken up by the next generation of doctors? Are you seeing?
I would say it was like I was doing this ozone since almost 24 years now. Like I started in 2000. But 2000 to around 2019, around 19 years, I was doing my work peacefully and I was getting my results, and number of patients were just increasingly like cats and dogs. And but I was curtailed because wherever I tried to give my ozone papers or something, it was still people were little skeptical about whether to, it's not a mainstream treatment.
Yes.
It's something which is alternative method. So whether to take it into a mainstream was a little always a question mark to people's mind. I mean, our major orthopedic conferences and journals and all. So I was also keeping quiet. I said, let me do my own work, and I was happy with my what I was doing. And then suddenly we bumped into L. Prakash. Of course, we met him in 1999, and then after for almost good 19 years, 20 years, we were never in contact with each other. But in 2019 or 20, when we met and just talked to each other, and he said, "What are you doing nowadays?" And I said, "I'm doing ozone." He said, "What ozone?" And he was just not ready to accept that this thing can happen. Then he listened to my lecture. And then he said, "Man, this is the thing, we have to put it into a big way." So then we formed the IOS. We are now conducting regular workshops, then conferences. We already finished around 4 international conferences.
Your last one was at Pokhara in Nepal.
Pokhara in Nepal.
Yes.
A wonderful conference. And we have, the best part is, we have more than 250 to 300 people. In fact, sometimes we have to refuse.
Yeah, exactly.
We can't take you more than this.
So the acceptance of this therapy among the next
slowly it is definitely great. And the youngsters are accepting like anything.
All right. Okay.
And the best part is that the people who have learned, these youngsters who have learned, and when they've started, and it's the best thing is, even if you learn in 2-3 days, you can start applying the fourth day in your practice, because anyway you are orthopedic surgeon. So most of these people, when they meet us or when we have a group and we chat and discuss, and next time when they meet us, they literally go to our feet and they say, "Man, you taught us and we have started this practicing. Our practice has gone 3 times to 4 times because our patients are so happy that they bring another 5 patients, 10 patients."
But this is still not taught in medical school, surprisingly.
No. But the best part is now, recently in MS Orthopedics, there was a short question on ozone therapy.
Oh, fantastic.
So it is coming out. Now they are planning also to put ozone as one chapter in pharmacological book. Oh, so once it comes into all this, slowly it will come into the mainstream.
And that is what we are hoping for,
We are hoping for that for sure. If that happens, and then automatically it becomes very much legalized, and then it can expand much better and much faster.
So what are the most promising results you say you're getting with these integrative therapies in certain conditions?
Like in orthopedic conditions, if you tell me, like the people suffering from frozen shoulder. Now, these frozen shoulders, people are taking a lot of exercises, medications, 3 months, 6 months, and still they are not able to move. They cannot move their hand, they cannot do their functions. The females cannot make their hair, they cannot wear their inner clothes. So it's so difficult condition, and they suffer like this for 6 months and 9 months. And when these patients come to me, I give them one injection of ozone along with a different cocktail in the shoulder joint.
Yeah.
And to your surprise, I can tell you that in 2 minutes, these patients will have a full range of movement of the shoulder, moving everything, and you see the smile on their face.
Yes.
And you will see. And that was actually in a Kochi conference in iOS. It was our first international conference. One of the orthopedic surgeon had a frozen shoulder, and he opted during the conference that please give me the injection and let me see. So it was a too much of a challenge to me. I said, now if I fail, then the people are not going to accept it. So I said, okay, people saw his hardly range of movement, painful. And I gave him the injection, and 2 minutes later I said, you get up now and don't think that your shoulder was ever into a trouble.
Exactly.
And show me this moment. And the way he did it, he started crying.
Oh,
I said, Doc, this is like a dream come true for me that in last 6 months I have not done these movements, and it has come. And people got up from their chair and they clapped together.
Wow.
It wonderful.
That's real.
This is wonderful moment for us. Yeah. So this is one thing which is, and another thing which I would say definitely to let the people know that the diabetes people, they get sometimes this neuritis. And this neuritis is like a burning feet, and they get tingling numbness in the feet. Sometimes they even wear the chappal, and the chappal comes out of the foot and they don't realize this. Now this, if they get from the day one, that they get this symptom, if they come and take this ozone autoimmunotherapy in the blood, 4 injections.
And weekly once or something?
No, weekly twice.
Weekly twice.
Weekly twice. In 2 weeks, take 4 injections. And that tingling numbness and all these things will just disappear.
Right.
And I have my own in-laws that who had severely uncontrolled diabetes. This 7 years before I had given the injection, these 4 injections, and now it is 7 years.
Till now, she hasn't experienced it.
And once this sets in allopathy, in Ayurvedic, in homeopathy, you name any science, there is no medication for this. They keep burning, they keep getting this severe pain.
They get temporary relief from B12 injections, and
that's it.
But not permanent.
I have seen these people putting their feet in the cold water in the night and sit all night. And they sit like this and sleep.
So the major autoimmunotherapy you talked about, how long does each session take, entail, timing-wise?
Hardly 10 minutes.
Right.
10 to 12 minutes. That's it. Your 100cc comes out because of the vacuum bottle. It just comes out in 2-3 minutes.
Right.
You ozonize it and then let it go, which will take around 10 minutes. So maximum 15 minutes, it's done.
All right. So it's not a cumbersome procedure where patient has to spend
And the patients, in fact, they come, they take it and they walk out.
It's just a day office procedure.
Absolutely.
Just sit in a chair and then have it, and then you walk out. Fantastic.
And now we have also extended this into EBU system.
Right.
EBU is extra blood, extra exogenous blood, extracorporeal blood oxygenation and ozonization.
Yes.
Now this is actually what we do is 100 ml. As I said, in a major autoimmunotherapy, we take 100 ml of blood and ozonize it. Here there is you take the vein here as well as vein here.
Okay.
You draw the blood out from here. It gets continuous ozonization and continuous go back to your body.
Right.
So it's like a continuation system where almost 1.5 to 2 liters of blood can be ozonized in one go.
And how long does that take?
That takes around 30 minutes, 35 to 40 minutes.
Excellent. So you are actually doing a much larger volume.
Larger volume. That's
1.5 to 2 liters.
So you can say like about 5 to 7 autoimmunotherapy which you do normally.
Right.
You're doing it in one
sitting. One sitting, 30 to 40 minutes, and that's done.
And then you don't have to repeat even for a month to 2 months. Maybe.
Right. Whereas the autoimmunotherapy, you have to do almost 4 sittings.
4 sittings. Twice in a week.
Right.
So it takes 2 weeks around.
Right.
This is you do one time and then finish about it for 1 month, 1.5 months, forget about it.
And the benefits are greater than...
Much greater.
All right.
Much greater. Because it's at one time, the whole thing is getting rejuvenated.
Right. Wonderful. I think it's been a real...
Now it is widely used even for cosmetics and all.
Yes.
You can have a glow on your face.
Right.
You can have a better hair growth. I mean, you tell me that I am looking young.
Oh, yes, of course.
I'm not taking
I couldn't believe that you've been practicing 40 years, more than 40 years. I was doing the mental math in my head, No, it's really wonderful. Do we actually use then any additional vitamin C or glutathione or nutrition or anything like that?
That's another subject altogether.
Right.
So it's like the ozone is an oxidant.
Right.
It's a very potent oxidant.
Yes.
Whereas we now use all these vitamins and other things are antioxidants.
Yes.
And that you can give. Now we use it, those medications in one saline, and then we infuse hydrogen through that.
Right.
Hydrogen gas.
Mm-hmm.
So this hydrogen gas is also a wonderful molecule, and it goes directly and acts into the mitochondria of the cells,
Right.
and rejuvenates the cells.
Right.
So if you do hydrogen, and first ozone, and then you do hydrogen, and probably repeat again next week, ozone and hydrogen, like these 2 sessions, and probably 3 months or so, 4 months, or probably 6 months, if you are otherwise healthy, you'll remain healthy.
Oh, fantastic. So you do one each week or one twice a week also you can do, I suppose.
Ozone you do once or twice in a week, but once you do hydrogen, you do ozone after some time.
Okay.
Because you don't want the antioxidant effects of the other B complex,
Yes.
other vitamin C and other things that we are giving to have any nullification because of ozone.
Yes. Fantastic. I think thank you, Dr. Shah, for being so informative and useful information for both the patients and the doctors, the new doctors.
No, the entire aim is to let these things go to the common mass.
Yes.
And let every smallest village or part of India or the world have the ozones and hydrogens available so that everybody's health can be
looked after, and the patient can make an informed choice about taking what treatment would suit them.
Suit them, yes. Positive.
Thank you so much for your time.
Thank you. Thank you so much.